it's Ben the Grail keeping you company on BBC Somerset. And all this week on BBC Somerset, but also across the BBC, there's been a big focus on the NHS. What's happening now, what could happen in the future. We keep being told by the newspapers, by commentators, the health service is in crisis. Now, whether you've seen that or not, you'll know that money is tight, services are stretched, we have an ageing population. That's particularly important for us in Somerset to remember that. That will surely only continue. So someone who knows all about this is as far as the local health service is concerned, is David Slack, who's the chief executive of the Somerset Clinical Commissioning Group. They purchase NHS services in the county. And he spoke to Claire on breakfast this morning. Here's a little bit of that, saying that although he thinks the system has coped well in Somerset recently, the CCG has overspent on its budget for the first time by about £10 million.
We're forecasting a £10 million overspend for the current financial year, and we're also looking at a gap going into next year. And what we're finding in Somerset, in line with many other parts of the country, is that demand is growing, and as we try and provide those services in the way that we have done traditionally, it is becoming unaffordable in a time when budgets are not growing particularly fast because of the constraints there are on public finances. And of course it doesn't just affect us, it affects colleagues in social care who've actually had reductions in their budgets, not just low levels of growth that we've had in Somerset. So I think in simple terms I would say the increase in demand is growing faster than the resources that we have, and that's what's led to the financial overspend.
That was David Slack, the Chief Executive of the Somerset Clinical Commissioning Group, speaking on breakfast today. Let's get the thoughts of one of Somerset's MPs, James Heappey, the Conservative Member of Parliament for Wells. Hello, James.
Good morning, Ben. You must, if you get beeps and stuff in the background, I'm on the floor of Briarwood, which is an amazing company up in Highbridge, visiting them this morning. So I talk to you from a huge warehouse full of things that they're selling all over Europe.
Thank you.
But forgive me if there's noises off.
No, that's fine, because Friday is your constituency day, so you'll be out and
Indeed.
about. Yeah. You've said in the past, as far as the NHS is concerned, that claims of a crisis are untrue. The Health Secretary said today problems are unacceptable within the service. So why, in your opinion, doesn't it constitute a crisis? It seems very serious.
Yeah, oh no, undoubtedly so. And of course, the speech I gave in Parliament was to explore the full gravity of the situation locally and indeed nationally. The reason I just counselled against the use of the word crisis is I think that there is nothing unexpected about the demand that we are facing. We know that the population is growing, is ageing, and we know that at this time of year, the demand rockets again. And that doesn't mean that things aren't extraordinarily difficult. The Health Secretary is quite right to say that there are parts of the country where it is just not working well enough. But it is possible to manage the demand that we're facing by taking all of the appropriate measures at this time of year. And so I just felt that using the word crisis was a slightly unhelpful thing, when what we should be focused on is not the headline, but how on earth we make sure that we deliver a health service going forwards that meets the demand that we know will continue to grow and grow and grow.
OK, let's just narrow down on something actually that was quite interesting that came out of David Slack's interview this morning. One of the things he said to Claire on breakfast was that if there was any extra money coming from the government, he would want to see it spent on adult social care. That's where it could make the most difference. Do you agree?
Yeah, I do.
I mean, the point here is that the last year, the government allowed local authorities, obviously Somerset County Council, to raise more money in this area with an extra precept on council tax. But do you think that's enough? Because that at the moment is around £3.9 million for Somerset. So we've been told by the services that it's nowhere near enough. So what more do you think the government should do on that?
Well, it is nowhere near enough, because the demand is going to continue to grow over the next decade and beyond. There's a number of options, really. The government does need to come up with some more cash, but of course that cash is, the government doesn't have its own money, it only has our tax money, and so working out whether or not that tax is raised through local government on council taxes or whether it is raised on income tax is one of the big challenges. And if you're going to spend more on adult social care, you've got to make the savings from elsewhere in the government budget. But we must do that because we know that we are going to face an ever bigger bill for adult social care. What we also, however, need to look to do, and I had a number of really interesting meetings in the last few weeks with village agents from around my constituency. Yesterday with Justin Sargent from the Somerset Community Foundation, and you just start to get a sense that actually what we should also be looking to do is look at how within our communities we can tackle loneliness, we can support the most vulnerable. There's a growing network of micro providers in Somerset that I know the village agents are all very keen to grow and to sort of understand and connect those micro providers with those that need the services. There are lots and lots of community groups in our communities that we could be looking to sort of help to address this challenge. There's a way of looking at our population which I think is quite interesting, and that I've been discussing with people, where we do have quite a large retired population. But if you look at the number of people where in the population the people that want to come forward as sort of micro providers or that run community groups, they tend to be people in their sort of first 10 years of retirement. Now, we have lots of people of that sort of age in Somerset, and then we have lots of people who are sort of later into their retirement who need the support that those sorts of groups offer. So is there a way that through the Somerset Community Foundation, through the village agents, through the county council, through the CCG or Somerset Partnership NHS Trust, is there a way that we understand that network of providers that are in the charitable and voluntary sector, and that we sort of bring them together into a network that helps to meet some of that challenge, as well, of course, as the government just having to write checks?
How much do you think the public's attitude potentially needs to change then on the NHS, this acceptance potentially that the service is under pressure, and we as a population, as patients, need to change the way we think about how we access the health service?
Well, I mean, I think we should always expect that the NHS is free at the point of delivery and available based exclusively on clinical need rather than any sort of ability to pay. But you would get plenty of GPs who came on to your show, who would come onto your show, I suspect, and tell you that you do now, the nature of healthcare has changed in a way that people sort of turn up having Googled their symptoms, and in an 8-minute appointment, sometimes the first 5 minutes is spent telling people what they've not got, and then you get 3 minutes to sort of tell them what they have got. And that is just a sort of a change that GPs often tell me makes their job slightly more challenging. I don't know that we need to sort of change our conception of it. We need to sort of understand, I guess, that smart healthcare going forwards, as has been designed in the STP, is increasingly going to be about sort of prevention upstream. So a greater emphasis on public health and making sure that we all understand that the lifestyle choices we take, what we smoke, what we drink, what we eat, what exercise we do or don't do, that those all have impacts on the health service going forwards, and that we can sort of help ourselves and help the country's finances by making smarter choices in that regard. We need to make sure that we have far better community, sort of upstream interventions on mental health. Far too much mental health in this part of the world in particular is resolved only at the point that it gets to crisis, and that is the most expensive part of dealing with mental health issues. And I know that's an issue that you're very passionate about, rightly so. We need to see, much earlier interventions so that people can manage their mental health issues and be treated for their mental health issues in a sort of much earlier and therefore less expensive way. We need to think again about the way that we deliver convalescence and recovery when people have been in hospital. The stats for hospital-acquired infection are huge, and so there is obvious evidence that people recover better in their own homes rather than staying in hospital. But of course, you can't just kick them out of hospital until you've got that network of community health providers there to make sure that they can be clinically supported in their recovery at home. And that's the key point. As we transition towards this model that brilliant minds like Matthew Dolman, Nick Broughton at Sompar have designed, these people who really know what they're talking about, we've got to make sure we resource that transition, because it is true that they they are right to say that they can deliver a healthcare system that will meet Somerset's needs, and they would have designed what they've done, whether there was a cost restraint or not, because thinking on healthcare has changed, and they want to reflect that in the way that our health system is designed. But we've got to transition to that new system, and that will require some resource from government, and that's where we MPs need to make sure that we get that cash.
James, thank you so much for being with us this morning. James Heappey there, the Conservative MP for Wales, talking to us as we finish this week across the BBC NHS week.